You have one person getting ready while you're seeing someone else. With 3, that opens it up a bit because then you can have a room that's a little more dedicated to longer stuff.
Healthcare services for residents of Raymond are now much more convenient. After a 2-year renovation to the hospital's vacated long-term care wing, the town's physician clinic and a number of healthcare services are all under one roof. Community Medical Director Gregory Smith says the move will allow them to provide their services much more easily.
We are hoping for a lot of efficiency gains. Right now, the physicians cover the hospital and the clinic, of course, and we've had an increase of about 50% of our ER visits. That is to say that since 1997, our ER visits have essentially doubled in Raymond, and that's increased load on nursing staff here and on us because we have to be one place or the other. More and more, especially in the last year or so, I've had days when my entire clinic in the afternoon has been canceled because I've had to come to the hospital to look after somebody. And that's not often something where I'm working every single minute, but I have to be here. I'm waiting for lab tests. I can't really go anywhere until the dust settles and I figure out what's going on. So that will often inconvenience patients who've scheduled to see me just because I'm away on an emergency. Now the emergency room is maybe 100 yards from the clinic space, so I can go down there, I can see them, I can come back, I can see a few patients. You know, I'm still on site.
Director of Primary Care and Chronic Disease Management for Alberta Health Services South Zone, Barb Lockhart, says the 1,100 square meter wing transformation brings together a number of services.
The concept that we've used here is to bring all of the health services from the community, as well as one of our community partners, which is the FCSS, or Family and Community Support Services, into one location so that when the patients require services, they just have one place to come to. So we have our physician and their clinic and all of the services they provide, as well as then our home care, our public health, environmental health, children's allied health are located here in this area for them.
Lockhart says she thinks residents will appreciate the convenience of the $3.4 million renovation.
There is access to the hospital as well, so that if there is something that is uncovered that is more and requires a different level or urgent care from that perspective, they can go to the hospital. They don't have to be transported from where they are back to the hospital. And I think for the staff and the physicians and the other team members that are working here, it's just that ability to collaborate on the patients that we all see and that we share the care for.
This model has been put into place in other southern Alberta communities, including Taber, and proven successful. For Go, I'm Fallon Wagner.